Hello, everyone, and welcome once again to our monthly Talk with the Doc with Dr. Akil Taher. And we are in the month of February, Heart Health Month. And of course, Dr. Akil is going to address heart disease this month and what it looks like for women and for men, because a lot of people just don't know the differences when you're talking about heart disease. What it looks like for women is different than what it looks like for men. Um, the end result might be the same. That's what we're actually looking to make a difference in preventing heart disease. So, without further ado, because you all know this gentleman is a practicing physician, a septuagenarian athlete, about to run a 5K tomorrow, and just has a heart for sharing this information so that others don't suffer needlessly because of heart disease. A lot of us think that it's part of our genetics if we've had it run in our families, but um, I'm sure that he has shared and will continue to share that we have control over it by the things that we do. And so, without further ado, Dr. Akil, welcome. Thanks for doing this.
Thank you. Thank you for having me, and thank you for that rather generous introduction. This is the last day of the Heart Month, and we have done a lot of talks on this month on heart disease. This is particularly important because I am going to tell you the differences between heart disease, namely coronary artery disease, in men and women. So let me go ahead and first of all get my slides out here. All right. So we all know that heart disease is the leading cause of death in the US and worldwide. For both men and women, killing more people than all the cancers combined. Even during the height of COVID, coronary heart disease was the number one killer, far exceeding the deaths due to COVID. But, folks, the sad part is that only 50 to 55% of men know this fact, and only 40 to 45% of women know the fact that it is the number one killer. And so we have to spread this word around. And younger people are getting heart attacks in their 30s, 40s, and 50s. And 50% of the people die with the first heart attack. So it has to be taken pretty seriously. Go to the next slide. And so we have this heart. It is a very resilient organ. It can withstand and recover from psychological stress, physiological stress, emotional stress, mental stress. But what is the size of your heart? It is the size of your fist. And it beats 100,000 times a day and pumps 2 gallons of oxygenated blood to every tissue and organ in your body through 50 million miles of arteries. So, in a 75-year lifetime, like I'm going to be 77 next month. My heart has already beaten more than 2.5 to 3 billion times with a B. So we have to look after this heart. How do we protect this jewel lying in your chest cavity? You see, we have this coronary arteries, and you don't have to remember the names, but the right coronary artery, the left one which goes down, and the one which goes behind is called the circumflex, and this is the left anterior descending. Now, if you upside down the heart, then why are they called coronaries? Because they crown the heart. If you take the heart upside down, they'll crown the heart. And this particularly left descending artery is called as a widowmaker because a lot of times when that is involved, people die. But why a widowmaker? Why not a widower maker? Because for the longest period of time, we were taught that it was a man's disease. This is what we were taught in medical schools. It was all in my textbooks way back in the 60s, 70s, 80s. In the mid 80s, people started wondering. Then they found that a lot of women were dying of heart disease in the mid 80s. And they figured out that it was because a lot of research was done on men and not women. So women were dying as many as men were in the same numbers. So that is why, if you look at 2020 statistics, there are 315,000 women who died of heart disease, namely coronary artery disease. That makes it 1 in 5 women in the US. And 16% of women aged 20 and above have some sort of atherosclerosis or blockages in their coronaries. So we should now call it not only a widowmaker, this artery, we should call it a widower maker. So to understand these coronary arteries that I showed you, we to understand the blockages, we need to also understand how the coronary arteries function. And that helps you to understand the difference between angina and heart attack, because it is important to understand this. Because angina, your options. Heart attack, there are no options. So let's take a cross section of a coronary artery. This is your coronary artery. This is your endothelium, the innermost lining of your coronary artery. This is your arterial wall. Now, this endothelium produces a very powerful substance, nitric oxide, which is mostly found in all the plant-based foods and fruits and vegetables. If this nitric oxide, which keeps the artery nice, robust, dilated, so that the blood starts flowing beautifully, smoothly. And it protects the arterial wall too and keeps it elastic and supple so that it does not harden up to cause you a high blood pressure later on in life. And remember, high blood pressure is also a silent killer. 40% of the US, 40% of people in the US have high blood pressure. And that, folks, is an underestimate because many of them are walking around without knowing that they have high blood pressure. So, and it is a silent killer. So when you have this kind of a situation, this explains to you. Now go back a little bit, see that coronary artery on the heart. Now equate this with what you are just seeing. So what happens when you have a lifestyle which is not good? What happens if you routinely have a rich, unhealthy diet? What happens when you have a standard American diet? Fried chicken, French fries, dairy, eggs, meat, pastries, or for that matter, a Indian junk food vegan diet, oils, processed foods, trans fats, sugary stuff. And I keep telling people that even though there is in some quarters you'll find, oh, ghee is it's clarified butter. Ghee is supposed to be good for the body. I disagree. The research that I've done shows that it increases oxidized cholesterol 10 times more than regular oil. When you have things like this, what happens to your coronaries? What happens to your endothelial lining that I showed you? It disrupts. Once it disrupts, the bad actors like your cholesterol, fibrin, calcium now come in and start depositing as a gooey stuff, the plaques that are called, and these are hard, and this take years and decades to form. And as they form, they narrow the lumen of the coronary artery, and the time comes when you have chest pain on exertion, when it is narrowed down to that level, and we call this as doctors angina. Remember this. This is angina. The plaques are very thick. In the meantime, what happens if the blockage is over here? Collateral blood vessels, new blood vessels start forming. And these new blood vessels that are forming now take the blood away from the blockage to distally, away from the blockage to the heart. So your heart is never devoid of any blood. So it can happen, but very rare that you can get a heart attack with this type of blockage, as opposed to a heart attack. So, what is a heart attack? This is your normal artery. Now you get all this disease arteries, the plaques are forming, but these are not hard plaques. These are soft, friable plaques, clots, and they form blood clots or emboli. And these blood clots go and start moving around. And when they block a certain part of the heart, you get immediately what we call as heart attack, and 50% of the people die with the first heart attack. So when you have a situation like this, not this, what happens? This is an emergency. You're having a heart attack. Can be a Hollywood or a Bollywood type of heart attack. Excruciating chest pain, dizzy, sweating, like a balloon about to burst, or an elephant sitting on your chest. And your blood work is done, and you find that you're having a heart attack. Your EKG is done showing that. You are taken up to the cath lab, and boom, 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 your clots are removed, stents are put in, and if those fail, surgery is done. This, folks, is an emergency. You cannot wait. Having said that, we are talking about a very important situation over here. As lay people, you should not worry whether that you should not try and differentiate between a chest pain of angina and a chest pain of heart attack. Go over to the emergency room when they do your test and find out that you are not having a heart attack. Then you have options. Now, just to tell you that my plaques were very, very hard. 98 to 99% of blockages in two of my arteries. They were unlikely to break. But I had stents, I had bypass surgery. So I always tell people this: had I known then what I know and am telling you today, I would have thought of other options. So that is number one important thing, which is for both men and women. Now, your symptoms, as we already said, excruciating, dizziness, sweating, uh, uh, no, uh, you have even nausea and vomiting at times. This can happen in both women and men. So the first thing you remember, this can happen in both, and this is an emergency. Your fingers should go 911, go to the emergency room. Now, having said that, But in 60% of women, the signs and symptoms of heart disease, coronary artery disease, heart attack may be very subtle, unlike in men. They may have very vague symptoms, subtle symptoms, extreme fatigue for long periods of time, shortness of breath, chest discomfort, not necessarily pain, backache, jaw pain, shoulder pain, indigestion, lightheadedness, upper abdominal pain. But so to give you an idea so that it is there in your mind, let us look at this. This is a lady who is extremely fatigued, like she has run a marathon. This is a lady who has got shortness of breath. She does not have any lung issues. She does not have any asthma. Here, with the jaw pain, neck pain, subtle things, your upper back pain, shoulder pain. So, what happens? More than half of women who have a heart attack don't recognize its symptoms. People have this idea of a Hollywood type of a heart attack. So when people don't have those classical symptoms of an elephant sitting on your chest, then they start thinking, well, this must be something else. But on the same grounds, please, please do not run to the emergency room if you've got back pain or shoulder pain. So here is an important thing I would like to mention. Do not ignore out of the blue issues. The take home message is to pay attention to change in patterns of your body. No one knows your body better than you do. For example, give you an example. If you're prone to indigestion and you ate a spicy meal, the burning feeling in your chest is likely a heartburn. But if you don't have indigestion and it comes out of the blue and the symptoms gets worse when you walk or when you're exercising, that's a warning sign that it is not your gastrointestinal, but something else. Even when you talk backache and shoulder pain, I mean, think about it. Have you strained a muscle? Have you lifted something heavy? Take a Tylenol, take an ibuprofen. If things are better, okay, it's a muscular pain, it's tendonitis. But if it does not improve, nagging pain going on out of the blue issue, it has not happened to you before, take it seriously. I know a patient several years back who had come to our clinic with a toothache. And we did everything. We sent her to the dentist. Eventually, they even extracted the tooth, but it was found to be a heart disease. So take this seriously. Again, a few pointers that may help you to understand. Silent heart attacks are more common in diabetes patients who have diabetes, but they're more common in women as opposed to men. When they experience no symptoms, understated or otherwise, and they have a heart attack. Now, women are it's more common. Now, even if a doctor in the emergency room thinks that this woman is having a heart attack, the event may not show up on a standard test that looks for proteins in the blood. Your heart muscle, when you get a heart attack, is damaged. It throws out proteins in the blood. These are called troponins. Now, the heart attack screening tool, why? Why? So people want to know, why is this release of troponins not very effective in women? Because they're not very specific in women. Why? Because women generally have lower baseline levels of these proteins called troponins than men. And the threshold levels set for diagnosing a heart attack were initially based on studies predominantly involving men. Now there are more sensitive troponin tests, which are currently being used in some centers in the US and UK. And having one of these sensitive tests boosted women's odds of getting a heart attack diagnosis increased by 42%. To come to an end of this part of the slide is also there is a huge difference in how men and women are treated following a heart attack. You see, studies have shown that they're less likely to get stents or clot bursting therapy, or even after that, they're less likely to be sent to rehab. I'm not saying that every center does this, but these are studies that have shown this to happen. So we move on from here to the W.I.S.E study. Bear with me on this. This W.I.S E study shows sex differences in heart attacks. Let's look at this picture first, the lower one. This is a male pattern heart attack, that Hollywood type of heart attack, horrible chest pain, EKG is done, and the doctors see this hugely abnormal EKG. There's a big clot in the center of the artery, and they go up to the cath lab, rid of the clot, and that's a man's heart attack. Men explode. What happens to women? There's a whole bunch of women who also, there are women who have this kind of heart attack too, but there are a bunch of women who have this heart attack where the clot does not completely fill the artery. The symptoms are subtle. The EKG findings are different. Female pattern, 62% of women have non-obstructive blockages. Coronary artery disease defined as less than 50% of blockages. So what do you think happens to these women? They're often not recognized by the physician in the ER and they're sent home. Thinking might have been gas, you can go home. That is the main thing. Men explode, women erode. So here we come to more of women's heart disease, how it differentiates between men. This is a coronary microvascular dysfunction. It's very easy. Just bear with me and I'll get you through this. How can women have heart attacks without having any blocked coronary artery disease? Women can have. It is in men too, but much more common in women. What happens here, the blockages are not in the main coronary arteries, but in the smaller arteries, the microvessels. These are tiny arteries that branch out from the main coronary arteries and which carry oxygenated blood to the muscles. These small arteries, tiny arteries, these are too small to be seen by the angiogram. And they are the ones that get tightened, constrict, and blocked. So you cannot see them in the coronary arteries. So how do you know that you're having this? There is a test. It's called the coronary reactive testing. It lasts for about an hour or hour and a half. But the doctors first measure the blood flow to the heart and then inject a drug that dilates the small arteries. And then which increases the blood flow. If the blood flow does not increase, then more likely than not, this is your small artery disease, your microvessel disease. Treatment, of course, is all this exercise and dilators, but a whole food, plant-based, no oil diet helps a lot in this coronary microvessel dysfunction. The symptoms are same like a heart attack. Shortness of breath, chest pain, but it is not in your main coronaries. So take, for example, there's a woman that comes to the doctor, and the doctor does uh, a stress test. And the test is positive. That means not enough blood is going in a certain part of the heart. Now you do an angiogram. An angiogram is negative. The coronary arteries are not affected. This is the time when you have to ask the doctor, can I have some other? And if you consistently and persistently keep on having chest pain and your coronary arteries are clear, ask for a coronary reactive testing. We go on to the next one. Come on. Coronary vasospasm. These are the coronary arteries that get into a sudden spasm. It reduces blood supply to the heart, causing chest pain similar to an heart attack. And now, remember, it is spasm. So once the spasm is over, everything is clear. There is no plaque, there is no blockage. It can be triggered more common in women, triggered by cold weather, um, stress and anxiety, hyperventilation, illegal drugs, cocaine, amphetamine. This can cause. But in a relatively healthy individual, a single episode of coronary vasospasm does not have long term consequences. And your angiogram can look completely normal. Now, to stop the vasospasms, again, doctors use a lot of medications, but whole food plant based, no oil diet is the way to go. We go back to broken heart syndrome. This is mostly found in women 50 to 70 years old. This is a condition that can cause rapid, very fast, but totally reversible heart muscle weakness. See, what happens is that if you are very emotional, stressed, grief, fear, extreme anger, sudden surprise, or physical, high fever, stroke, asthma, significant bleeding, very low blood sugars, that can cause your overstimulation of the sympathetic nervous system, your epinephrine and norepinephrine. You don't have to remember those names if you don't. But these can cause the small microvasculature that we talked about can go into blockages, and that can cause the muscle, the effect on the muscle. So, what it does is it sort of weakens the left side of the heart. And therefore, the left side of the heart, the left ventricle, but the left side of the heart starts ballooning. And as some people have said, into a shape resembling a Japanese octopus trap. So that is what it looks like, a big balloon, but completely reversible. The EKG will sometimes show, may not show. Angiogram, there are no blockages, but an echocardiogram will show the ballooning of the left side of the heart. Now, recent research of 2024, two molecules are linked to increased stress levels, which play a key role in the development of broken heart syndrome. So, why I'm talking to you about this is that if you are in a bind and you don't have any answers, you can go back, look at this, listen to this talk of mine, and see what you can ask your cardiologists and your doctors. Common risk factors for heart disease in men and women. We all know this. Diabetes, high blood pressure, cholesterol, family history, smoking, physical activity, no proper sleep, overweight. The most important thing is your unhealthy diet. It is heart disease is the leading cause of death, but the leading cause of heart disease is your diet, your processed foods, your caloric dense foods, or no fiber or probiotics type of food, diets deficiency in fruits, veggies, whole grains, legumes, nuts, seeds. That is the main thing. So these are common factors. But now we come to an important thing. Women have additional risk factors. And this is complications during pregnancy that are associated with increased cardiovascular risk later on. First, you have is gestational high blood pressure. High blood pressure during pregnancy and the later part of pregnancy, which completely resolves 2 weeks after pregnancy. I'm laying stress on the word resolves. Preeclampsia, 8% of all pregnancies, when you get high blood pressure, there's swelling in your legs and protein in the urine. Completely resolves. But at that time, if you're not careful, it can go into eclampsia where you've got seizures and you're admitted to the hospital. It is dangerous. But otherwise, completely resolved. Gestational diabetes. Diabetes during pregnancy. 4% of all pregnancies resolves completely 6 weeks after delivery. So what happens to these women? Everything is resolved. They don't have diabetes now. They don't have high blood pressure. So they fall through the cracks. These women need to be monitored as they are more likely to get cardiovascular disease in future. So if you have people that you know who gone through this, please tell them. You need to go more often to get yourself checked for heart disease more often than other people. Number two, if you got miscarriage, preterm delivery, and stillbirths, can increase your risk of coronary artery disease or cardiovascular disease later on. Early puberty and early menopause in women can be associated with an increased risk of heart disease. Now, I just don't understand. The age is getting less and less regarding puberty. I mean, I've seen in my practice 9 and 10 year olds getting starting the periods. What is that due to? Maybe due to hormones in the dairy products that we have, processed foods, pesticides, caloric dense foods. I don't know. But it seems to be getting younger and younger females are getting their periods. And these is a risk factor for having heart problems later on. Similarly with early menopause. And some people do get early menopause, but sometimes in your midlife, in your 30s and 40s, if you're not very careful in your lifestyle, you may get an early menopause, which points to getting cardiovascular disease later on in your menopause. Types of birth control pills can cause blood clots that can lead to heart attacks and stroke, especially for women who are 35 and who have got high blood pressure. POS, people may have heard of this, polycystic ovarian syndrome, where you have more male hormone, you get hair growth, blood pressure, obesity, more prone to getting heart disease. And this again in 2024 studies have shown women with genetic predisposition to depression are more susceptible to heart disease. Menopause. Common symptoms are hot flashes, night sweats, and sleep disturbances. These are all perimenopausal symptoms. But your increased health risk when you reach menopause is your early menopause. And even in a menopause, there is high risk of getting the small artery disease, microvascular disease. You start getting increase in abdominal fat, which was not so much, but men tend to keep the garbage in their bellies. Women do not. But in menopause, they can get abdominal fat. Your bad cholesterol increases, your triglycerides increase, your blood pressure increases, your blood sugar goes high. And there's high sensitivity to salt at that time. And that means your high blood pressure can go up. Great likelihood of depression too. So there are genetic factors on early menopause. Natural menopause has a lower cardiovascular risk. Be proactive, healthy lifestyle changes during midlife can negate or mitigate cardiovascular risk at menopause. Now comes hormonal replacement therapy. Estrogen should not be used for heart protection, period. Potential risk includes stroke, breast cancer, DVT, deep vein thrombosis, and cardiovascular disease. If you have to use, if the doctor thinks it is necessary, it should be only used for a very short period during the perimenopausal phase. I do not agree with that, but if necessary, then that is the only place that I would use. Now, depend on natural remedies. So we have got less estrogen during menopause. Go phytoestrogens, plant-based compounds that mimic estrogen. Soy, flax seeds, chickpeas, lentils. Avoid caffeine, spicy food, alcohol. I don't know much about this, but they say black cohosh, red clover contains isoflavones, magnesium, and omega 3 fatty acids help. Then there are mind and body approaches, cognitive behavioral therapy, and lifestyle medicine. Now, this is important. Carry this message all over every woman that you know in your life. This is very recent research that is being done. This research was published in New England Journal of Medicine on August 31st, 2024, and include data from nearly 28,000 participants. What is it? 3 tests that could help predict risk of heart attack, stroke in women. What are these? A team of researchers looked at 3 biomarkers. First, the cholesterol LDL, and number two, the C-reactive protein that shows signs of inflammation. And number three, a lot of talk has been going on right now about this LP little a. That if these 3 metrics are high in a woman, no matter how old, there is a likelihood of a cardiovascular event at least 30 years later. The risk increases. So if you have these 3 markers, get yourself or rule out heart disease. Cholesterol, LDL, CRP, and LP little a. So your LDL should be under a 90. Your CRP less than 1, I believe, is normal. 1 to 3 is moderate risk, and over 3 is major risk. And your LPH should be under 30. 30 to 50 is borderline, and after 50, it is really abnormal, high risk. My LPA does not change. It comes through your family. Now, my LPA is 361. So, but my LPA, as one of the listeners on this program, Rochelle, did some research and told me that if you have this Repatha, which are blockbusters in terms of getting your cholesterol down, can decrease your LP little a. So that is as far as this is concerned. And number two is that you have mammogram analysis. When you go for your mammograms for your breast, you can easily detect breast artery calcification. You don't have to do an extra test. This may serve as an indicator of cardiovascular risk, apart from the calcium score and all that. This is easily done. So here we are now with our final thoughts. Number one, awareness. More aware that heart disease is the leading cause of death. They should be telling other women too. Risk factors are different between men and women. Some are common. Subtle symptoms of heart disease in women, we talked about those. The out of blue issues, you know your body best. Microvascular blockages will show blockages in the small vessels, but your angiogram will be negative because of your coronary artery being, uh, there are no blockages in your coronary artery. Silent heart attacks are more common in women. And then you have, we said this, if you have a positive stress test but a negative angiogram, you should be tested for microvascular blockages with the coronary reactive testing that I talked about. Pregnancy complications and menopause, we talked about, they have an increased chance later on of getting a cardiovascular disease. And finally, uh, it is also women tend to get more symptoms more often when resting or even when asleep. Emotional stress can play a bigger role. Uh, Women are more likely than men to have a heart attack with no severe blockage. We talked about that. And women usually develop symptoms of cardiovascular disease about 10 years later than men. And estrogen should not be used to protect the heart after menopause because of blood clots and strokes and cancer. And finally, women should ensure the symptoms are properly diagnosed. This is very important that they take their symptoms, subtle symptoms, seriously, and the doctors take their symptoms seriously to advocate for themselves more strongly. With that, I end, but there are new breakthrough in the war on heart disease. And this is the first one is useless. I don't believe in that. The cholesterol smashing drugs, we talked about Repatha, which now decreases LP little a. You got biodegradable stents. If you need stents, then these stents remain in as long as long as medication and your lifestyle changes take over, and then they sort of dissolve. And this is the clearly test coronary computed tomography and angiography, CCTA. It's important because this differentiates, first of all, it shows how much of plaque you have in your coronary and whether your plaque is hard, non breakable, or it is soft and fragile. So, this is done by AI, artificial intelligence, and some of my patients have gone through this. So, keep that in mind just as a last resort if you have to. And that brings me to an end. Thank you so very much. And I have all my website, Facebook, Instagram, YouTube, Twitter. I also have started shopping and cooking. Uh, but in any case, please, I want your comments on that more than anything else as to if it is helping you. The last one we did was uh, ultimate quinoa salad, and we did a bean soup, a 15 bean soup. So check out on that and tell me whether it is what you felt, whether how should I improve with that. And that brings us to an end, and I'll stop sharing and come into looking at all of you now.
If you have questions, please put them in the chat or raise your hand and you can ask. And you can turn your video on. That will work as well.
Julie, your mic is off. Hello, Francine.
Hey, how are you?
Hi,
Doing
Francine.
Hi, how are you?
Good. How are you doing?
Pretty
Glad
good,
you
pretty
could
good.
join us today.
Yeah,
Yeah.
I had a bit of an interruption that put me late, but I did manage to get here after all, so that was good.
Good, good. Any questions?
I have one hand up over here.
Okay.
Go ahead,
Atmajit.
unmute yourself and ask me the question. Atmajit, right? You want to ask me?
Yes,
Yeah, can you
there
hear
you
me?
go.
Yeah, I
Can you
can hear.
hear me?
Yes.
I
Yeah.
can.
Okay, Dr. There. Yeah, I've read your book. I've got some emails from you from the too. That's very kind of you. You had a pretty bad blockages. So I'm wondering what was the reason for those blockages? You don't have diabetes or cholesterol. Um, and number one, and number two, after having your bypass, there is a chance of restenosis. Like I had my bypass in 2020, but they just did a stress test and I passed. So my blockages have not reached, there's no restenosis. But with the high LP little a, uh, LP little a can cause restenosis. So is it your sheer determination and, uh, those marathons that fight against all those things?
Not really, but your very, very good questions, both of your questions. Why did I get a disease? Number one. Uh, I it is not the question that if you don't have diabetes or you don't have cholesterol. The question is the diet kills. And I was an unhealthy eater. I ate everything at sight.
Right.
So you can imagine what I must be going through. Uh, I ate indiscriminately. Number one, I had absolutely no clue of what exercise was.
Yes.
Not even done half a kilometer before I got into my stents.
Yeah.
And number three is that my workload, I was working nonstop, paying little attention to my health. And all this created a stress which we don't realize, but it manifests itself in different forms.
But don't you think your high LP little a was mainly responsible for those tough, that you needed a diamond cutter to cut your blockages? So don't you think your LP little a was the main culprit?
Right, but at that time nobody tested for LP little a. My
Yeah.
LP little a was tested only 1.5 years ago.
Yes, I personally believe that it was your LP little a that led. I mean, everybody eats you don't have diabetes, you don't have cholesterol. That's like a very plus thing, for against having a heart disease. But LP little a is a risk factor, and I think I personally believe it was LP little a. But after you got your arteries cleaned, your sheer lifestyle and your sheer determination fought against the ill effects of LP little a. That's what I believe.
Atmaji, let me tell you one thing. One of the things that has helped me is not my exercises. Of course, exercise has helped me, no doubt about it. But it is my whole food plant-based diet.
Yeah,
It is
I'm
my
also.
whole food plant-based diet that has kept my endothelial lining now. So that even if the LP little a is there, what is LP little a? It is like a type of LDL, bad cholesterol, but with Velcro on it. So it
Right.
attaches to the coronary artery, correct?
Yes.
If your endothelium of your coronary artery is healthy, with a whole food plant-based diet or a lifestyle, all the six pillars of lifestyle, then this cholesterol cannot attach to the endothelium.
Oh, okay.
Diet is the most important thing. Now, having said that, I'm not asking everybody. First of all, I want you to all of us should be following the six pillars of lifestyle medicine.
Yes.
Most important pillar, the conductor, so to speak, the cornerstone, so to speak, is your nutrition, and
Yeah.
your rest of them complement. So, of course, exercise helps, of course, sleep helps, of course, avoiding substance abuse helps, all that. But it's your diet. And your number two question was my restenosis. My same answer. My restenosis can happen. I'm not saying that. My LP little a is very high. But how am I protecting myself? By the diet,
Yeah. Because
by the
Chapata.
exercise, by improving my sleep level, by
Yes.
avoiding the substance abuse, and a good, robust social support and stress. Now, am I great in all these six pillars? No, I'm a work in progress.
like we all.
Yeah.
We
Yeah.
all are. So that is what I'm saying, that if you follow these 6 pillars as far as you can,
Okay. Yeah.
get out of
Yeah.
the loop.
Agreed. Yeah.
Anyway, good question. Good question. Go ahead.
Yeah. Yeah.
Anybody else? Shoot.
Uh,
Oh, Rochelle.
Thank you, doctor. What are your thoughts? I take these they're nitric oxide supplements. Do you have
Uh,
any thoughts on these?
See, I don't really know in depth about these nitric oxide supplements, but I believe, Rochelle, that if you follow and your best nitric oxide suppliers are your berries and your fruits and your plant-based vegetables. I have given a talk on erectile dysfunction, and I always say, would you rather have a blueberry or a blue pill? So that's what I'm trying to say. It's a coronary artery dilator. It is so when you say coronary artery dilator, you are talking about your arteries in your kidneys, in your legs. Because if you get that in your brain, you get a stroke. If you get it in your legs, you get leg pain. And if you get in your kidney, you have a kidney failure. But I don't know about this nitric oxide supplements. A- And see, the LP little a is so much in common in right now. If somebody is bound to come around somewhere in the next 2 months or 1 month, that this will increase your LP little a.
Probably.
Till it is tested, I am not going to try
Yeah.
on it.
Yeah. And you mentioned a sedentary lifestyle is one of the risk factors, which I've always had. So how does exercise help your heart, I guess, once you do have heart disease?
Yeah, let me tell you. See, first of all, I wanted to tell you all also that another risk factor is COVID or heart disease. If you got COVID at any given time, the next 3 years is COVID becomes a risk factor for heart disease.
Oh.
Mm.
This is recent that I have done some research, and they said this is the one. And to answer your question, what was your question again, Rochelle?
How does exercise
See,
help your heart, especially if you
exercise.
have heart
See,
disease?
see, yeah. Once your heart disease, which is stable, if you're unstable, we don't know. If you got, for example, fragile plaques and you're doing this thing, I still feel a certain amount of motility is not going to be bad. But where exercise helps is, and if you're doing it properly, 30 minutes of exercise every day, moderate to severe activity, running or jogging or biking or dancing or whatever, whereby your heart rate goes up to about 70 to 80% of your maximum.
Mm.
Now, if it goes 70 to 80% of your maximum, that means that over a period of time, what will happen is your heart rate goes down. So if you take an athlete, his pulse is 60, 62, as opposed to 72, 73 in other people. That means his heart is doing less work to get the same results. Number two, if you are exercising and you have to get, first, I was always telling people that for 30 minutes, you should be getting your heart rate up to 70 to 80% of your maximum heart rate. Now I don't, because the recent research says that intermittent, you can get in the 30 minutes, 6 to 7 minutes or 8 minutes, your heart rate can go up to 70 to 80%, and then you can come back to normal.
3
Having said
times
that,
a
what
day.
happens is when your heart rate goes increasing, and then you wait and see how long does it take for it to come back to normal after you're done intense activity. The longer it takes, the more unfit you are.
Mm.
So it should take a short period of time to come back to normal. That's number two. Number three is stable heart disease. Now, I understand where you're coming from, Rochelle. Exactly know what you're trying to, but I believe that in your case, strenuous activity, no. But if you talk about motility in terms of fast-paced walking and all that, is a must. And no shoveling ice.
I mean,
No.
but what does it do? It does it help remove? It doesn't remove the plaque. It just what makes your arteries stronger, or
What? What?
the exercise. Like what?
That's what I said. Because your heart is working less now, and you're opening up those coronary arteries. You're dilating it more. In some cases, even your endothelial functions better. So all these are things which are giving. Ultimately, what do you want? Your more supply to your heart, blood to your heart, blood supply to your heart. This is what we are doing. So when you do that and your heart is pumping fast, it is pumping to give blood where? To your different parts of your body, as well as your coronaries are working. So, and there are, Olga was the one, I believe, but that is a different story. But exercise is important. And I, even if you have severe, say, osteoarthritis of your knee, you can get your heart rate up by doing rowing.
Mhm.
You can do it by yoga. When I do yoga, I'm not an expert at all. But when I do whatever yoga I do, my heart rate goes up. So you have to get your heart rate going up. And then number two, after doing that half an hour or something, don't be like me in the past, was lying on the couch. Keep moving, moving.
Sitting is the new smoking, they say, right?
It
Absolutely.
is. Mm-hmm.
Absolutely.
Mm-hmm.
It is a problem. That is why if you're in the blue zones, people move a lot. They're constantly moving. And moving, you can also do it with groups of people that helps.
Classes, yeah.
I just joined, what is it called now? The game, Lynn,
Pickleball.
pickleball. I have started taking lessons for that.
Hmm.
I'm so bad. But I'm not going to give up. It's a new challenge, unless people don't want to play with me after they realize that's a difference. Okay, go ahead. Next question.
I was just going to make a comment, Akil. I thought by the time I got to this age and I'm unencumbered, I've been retired for a while. I don't have any aches and pains. I do have high blood pressure and high cholesterol that I inherited. I thought I would travel more. But what I find is because I'm trying to control these things, these variables with diet and exercise, it's very hard to travel. Because when I travel, I don't know if I'm going to be able to get a couple of walks in a day. I get 22,000 steps of walking in a day. Sometimes it's not possible when you travel, when you're, and the same thing with diet. Sometimes certain foods that I like to eat, I was flying and at the going through the thing for the airplane, they threw away my oats and cranberries. They wouldn't let me take them on the plane. It's very, very challenging if you
Yeah,
travel. And that's why I tend not to travel as much as I thought I would. I thought I'd travel more, but I feel almost confined to what I'm doing now. I'm enjoying, but I just find it, if I deviate from leaving my routine, it's very difficult to enhance and continue my good habits when I travel.
I absolutely agree with you, Francine. It is a challenge when you travel. And but the point I'm making is if some people are interested, the National Health Association has cruises that are whole food, plant-based, totally. And also they have the exercise program and other lifestyle things in the, so they have
Hmm.
just come back from, where was it, Lynn?
Tahiti.
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 Tahiti. And now I think they have another trip that is going to uh, Cambodia and
In Japan.
yeah, Japan,
Oh, the
Cambodia,
cruises?
Thailand and all those places. But they're total whole food plant based No salt, oil, or sugar. But now, if you are on the cruise, you can ask for salt and you can eat the other
Yeah,
food too at times. But this is one of the choices that you have.
well, I didn't know that. Thanks
So-
for making it
Mhm.
smarter.
I went with the National Health Association last year to Costa Rica. And we had everything on the ship that was available. There were about 20 of us. We had breakfast, lunch, dinner, and they had, everything was fine. I mean, it's another way to travel. And they go to many different places. So if you're interested, and there's usually somebody from NHA who's there or some other, like, there are different chefs, there are people who show up, go on these trips. I think Furman's gone, a few other people, and it makes it really interesting. So
And so they just,
Mhm.
during the day, you get to go on to Costa Rica, wherever you want to visit on land.
Sure.
And
Yeah,
then,
the ship, we were on the ship, so I mean, we took off, we did excursions during the day.
yeah, excursions.
If it was an all day and I wasn't sure of what we were gonna have for lunch, because we were gonna be with a group of people from the ship, some of them were us, but not everybody was eating like we were, I would take food with me. I mean, I took containers with me from home that I had used the first few days, like on the airplane and when we first got there. So I had all these empty containers and I would fill them up with salad from the night
Oh.
before, the day before lunch, and make myself plenty of food, which in most cases, wherever we went, they had actually already provided for us. So there was a group, so everyone else could eat this, but the NHA group, you could sit at this table, we have food for you. So it was almost like I really didn't have to do that. They were very
Wow.
good about providing food wherever we went.
Susan,
That's
can I?
good to know. I
And-
had no idea.
Yeah,
Yeah, they also now have a few land travels.
yes, they do.
Like Tuscany, they have a couple of trips to Tuscany every year. They did a safari in Botswana last year.
Wow.
So they're a good resource for
It's called the
traveling.
National Health Association.
National Health Association, if you look them up on,
Association. Susan, can I ask you a question? When you are on the cruise, you
Yes.
can have other meals besides the plant-based, even if you're with the plant-based group, correct?
Yes.
it
You-
depends.
Yeah, you can choose.
It
Well-
depends if sometimes they have the whole ship is whole food plant-based. Other times they just have a group that's a part of the entire ship. And when that happens, you can have other things that are on the menu.
Exactly. And we went with friends who did not eat like we did. So at dinner, they tried to put all of the Whole Foods plant-based people in one area. So the waiters knew to bring you the special rolls and the specials, whatever it was. But we would eat with them in a different part of the dining room, but would just say we were with NHA and they would bring us all the same stuff. They would say, oh, no problem. They would bring us the rolls and the right menus because we had our own menu. And anyway,
But
it was good.
Good to know. Thank you.
Yeah.
Would not
another
realize.
thing, Francine, to answer your question is that I also take packets from Plant Strong.
Oh, do you? Okay.
Because they have all these things, powders and
Mhm.
freeze-dried substances. So I take a lot of that, the cereals and all that, because they don't have any added sugar or salt or,
Yeah, I usually pack my own stuff when I travel. but,
Leaf side is also good, but
Leaf
these
side.
these
side.
are
Mhm.
leaf side, they're freeze dried and they come, packaged, so they last a long time. You throw them in your suitcase or your backpack. So it's sort of good if you're several days into your trip and whatever you packed is no longer good, it's sort of worn out, gone bad, or you've eaten it.
Used up, yeah.
It's good to pull out one, add hot water, boiling water, and you've got yourself, a chili or a pasta dish or whatever it is.
There's another company called we have like a support group, but we had this guy who had
Oh, from
a
last
widow, yes, it's called Little Green Forks.
Right.
This guy had a heart attack fairly early, and he had in the Widowmaker. But anyway, he survived, and he only had a 3% chance, and came up with this Little Green Forks to have foods that he could eat himself. And they ship food all over the US.
Yeah, I personally believe that what you all we have discussed gives us enough opportunities of at least being on a safe side when traveling, But I do agree with you, Francine. Sometimes it is absolutely you're in a bind. You don't know what to do now, and
You
that's
get
the
tired of
time.
eating nuts and seeds all the time, right?
Yeah,
The problem with me is that I cannot start something, then I go berserk. I start eating then. So I have to be very careful on that.
And
We
I've been on other cruises where it's not Whole Foods plant-based. And I've had to talk with the maitre d' or the chef and I bring a piece of paper that has the information. I said, this is what I eat, this is what I don't eat. And it got a little testy at the beginning of one trip that we went on. And he handed me the menu. He said, what will you eat? And I said, look, you're having lentils with this. I'll eat those lentils. You're going to have some beets with this meal. So I pointed out 3 or 4 things. I said, I'm not going to eat any of your meals, but put together something for me, if you don't mind, please. And this and that. They caught on and they started bringing me, beautiful dishes that were artistically put together like the other real meals, but were exactly what I had asked for. And it can be done. This was a teeny tiny ship in Iceland,
And
and
another thing is that
they can do it.
you can always ask who's the chef, who is the cook in that thing. You
And
will
you
find,
talk to them one to one. Yeah.
yeah, there'll be Indian cooks, there'll be Mexicans, there'll be a lot of other people who will be there, and they'll be very happy to oblige you because I've done this too myself. And
Hmm.
and the first seeds, did you say, right? What did you say?
First seeds is another one.
First seed
Hmm.
is a very good one.
first
Hmm.
seeds.
Yeah.
First seeds.
Oh,
Now their
first,
stuff is all frozen.
all frozen. So
So,
all you have to do is microwave it.
hmm let it thaw or microwave it. But they've got good stuff. There's quite a few that you can do like that. One of the things that the NHA has done really well with is on the cruises and on the land trips, they've made arrangements with the restaurants that they want to visit to either call ahead or connect in some way to talk to the chefs. I'm going to be there. There's going to be 4 of us or 20 of us. Is it possible that you can have something in the way of a menu that has no salt, oil, or sugar? And knowing that chefs have the opportunity to prepare for it.
Mhm.
A lot of the hotels and a lot of the restaurants that actually want your business will do that and do it eagerly because the world is changing. We are getting more people who are looking at healthier eating. And so these restaurants are looking at coming into the space where they're accommodating more people so that they can stay alive. They can make the adjustments and, serve more. So ask. And I learned that several years ago because I would just go out and what's on the menu, and that's even locally.
Yeah.
And, even asking, sometimes you might have to ask a couple of times, but think about it too. One of the biggest suggestions I got was if you know where you're going, call in advance. Try and give them a heads up that you're coming so that they're not in the middle of, thinking about the clients or the customers they've got coming in and preparing on that, and then having to stop or shift. I heard Chef Dell one time, who's the executive chef for True North, who's does water fasting, medical supervised water fasting, and Chef Dell said it's the worst thing for a chef to get a request when they're in the middle of the dinner um, time and this request comes in and they have to shift gears. They have to think differently. But if they have a heads up, they can plan on it. They can actually make it look nice, like what Susan was talking about. Um, because that's what they want to do. They want you to be happy with what it
Mhm.
is that they're fixing for you. And we have to learn that just like we have to help them learn that.
Exactly. Good.
Julie, and Majid,
Yes.
you've had your hand up for a moment.
Yeah, actually, I want to talk about oils, right, which is a controversial topic. Olive oil, avocado oil, and avocados. I know Dr. Tahir is pro nuts, while some uh, some gurus like Dr. Esselstyn is against nuts and against oils. So there are uh like I want to know, is like avocado and avocado oil, what's bad about that? I know most of the oils are garbage, but how about olive oil, like, little bit, or avocado oil for cooking because of its higher smoke point?
Yeah, yeah. You see that the point is saturated and unsaturated. Of course, saturated oils are your palm oil and your coconut oil, which remain solid at room temperature. So coconut oil is very, very, very good, but not in your tummy, on your hair. That
Yeah, yeah. No,
That's one thing. So all these remain, and now these are saturated. Now, when you're talking about unsaturated, then you'd come across olive oil and your
Avocado.
avocado oil and the other oils. Now, the Mediterranean diet believes that a amount of certain amount of olive oil is okay. I don't, because in my now when I cook things without oil or with oil, it makes no difference. The taste is the same, provided you know exactly how to get your spices
Mhm.
properly done.
so how about avocado? What do you think about avocado?
No, I don't. I don't mind avocado as a vegetable or a fruit, but I would definitely not. I would not want to use avocado oil or any oil for that matter. Because
Right.
oil is nothing good. Now, when you said about Dr. Esselstyn, and there are people, for example, Dr. Esselstyn says no nuts too.
Yes.
I had in my own this thing when I'm taking the shots, and then I started saying that let me try nuts. And I
Yeah.
told you before that when I go on something, I go way out. So I
Yes.
started eating nuts. My
Yeah.
cholesterol just jumped.
Yeah.
High. So I immediately cut down my nuts. I'm not taking any nuts right now, but even if I take one or two cashew nuts or pistachio, that's it.
Walnuts are supposed to be good.
Yeah, they all say everything has a
They're
like
not, okay.
pistachio. Some people say that it has got melatonin, it helps to sleep. And yeah, one thing before I forget, Francine, you said you got high blood pressure, right?
Yeah,
And
it's inherited. I do all the right things.
magnesium is maybe an answer.
No, I have my blood tested for all those things and I'm in the normal range
No, magnesium is
for
just
magnesium. Yeah,
magnesium is just proven to decrease your blood pressure and also has melatonin in it, helps you to sleep. So this is just recent that I read. So
yeah.
it just came in my mind. Sorry.
Yeah, no, I appreciate it because I have had that measured and I'm in within normal limits, but I eat a lot of magnesium rich foods too. But
Correct.
I'm managing it well. And when I stay at home, I'm fine. It's just when I travel that I had to go to Houston for a funeral last minute. And it was fortunate I wasn't gone long, 3 days, but it really was very disruptive. The hotel did have a gym, so I was able to do that, and I was able to walk a little bit, but not much. It's just a challenge.
So just to
Your oil, this thing is that it's the same thing that if you want to use eat olives unsalted rather than olive oil, this is the things that goes on. But if, having said that, do I ever use oil? I try not to use oil, period. But there are moments in certain areas which I'm forced to. So I'm not saying I'm averse to it to a sense that I'm not going to touch and I'm going to die of hunger. No, but what I'm saying is, as far as possible, if you're doing your own cooking, you should not be using it.
Mhm.
even avocado oil.
Yes, all
Okay.
oils, and they are
Oh,
unsaturated.
Yeah, saturated is bad. Like that
Yeah,
there is no question about that.
we've gone.
Julie, did you have a question?
But wasn't really a question. It was just back on the subject of restaurants because my mother is highly allergic to seafood. She does eat meat. So anyway, that's another story. But whenever we go to a restaurant, we have to be extremely clear that she's extremely allergic to seafood. And so they have no problem, even though it may be right in the middle of their busy time. I mean, in other words, chefs all the time have to make adjustments, whether the person has celiac or is allergic to nuts or whatever. So, I mean, maybe if you're, like Susan was saying, a little more forceful as far as I need to have this for my health. You know, if they don't think you're just being, you know, trying to be piggy-ish, you know, but saying, I need this for my health, you know, if we can be a little more assertive, the more of us that are more assertive, the more creative they'll get with having a beautiful plate like Susan was talking about. So,
Mm-hmm.
So I have a funny story. I was out with a friend having lunch, and I thought I would get some steamed vegetables. Pretty easy, right?
You
So
should
I
be.
said to the guy, I said, I can't have salt or oil. So can you just make sure if you can steam them in unsalted water? And he bent down really low to me and he said, are you allergic? I said, and I think it was much easier to say, yes, I have allergies than to try to explain the whole way of living. Yeah. Well, we steam everything in one pot. So if we steam new vegetables, that's where we've steamed the shrimp and the chicken and the this and the that. It was a Vietnamese restaurant, and we steam everything in that same pot. Do you still want us to steam new vegetables? I said, no, no, thank you. And I whipped out my salad that I brought with me. You know, I was hoping I could buy something because it's insulting to always bring your own food, but I couldn't even buy that. I couldn't do that.
Wow.
Be forewarned. Find out if they steam them, if they're steaming other stuff in the same pot.
Well, would the salt get on it if you're if
Oh,
if
it was the
it's
shrimp and everything else that was in that. That pot had a whole day's full, you know, all this other food that
but if they were gonna put it in the steamer up top, it wouldn't be touching the water. It doesn't matter.
I didn't even want to go there. Yeah. It's in the
Yeah,
molecules. Yes, it would have.
yes.
Yeah.
It's in the condensation. The steam comes up and the salt is in the water,
Yeah.
in the
So
steam.
do you know the word pimp? P-I-M-P? Anybody here? The
I
potato.
know that, but not in a food context.
Okay, potato in my pocket. Potato in my
Yes.
pocket. Don't go anywhere without a potato in your pocket.
Okay, I
So
like that.
another one. Yep.
But
Uh,
it
actually,
was really, really nice. We all could talk about it. We discussed, we shared ideas. I'm so happy to be here. And thank you all very, very much.
thank you,
Thank
doctor.
Hey,
you.
doctor.
thank you.
Namaste.
You're
Good
awesome.
to see
And
you.
we'd love for you to check out Dr. Keel's Shop and Cook with the Doc. I put his the link in the chat and I'll just share really quickly.
Yeah, I would really
Uh,
like that, because I'm more nervous doing that than doing this.
so
And
it's
I'm always
free.
backing the camera or something like that. So please, I want some honest comments about it. And try the recipes. See if you like it, because these are some of my wife's recipes. So I go the next time. One of these things is minced tofu,
Hmm.
along with spring onions and all the things that we have, and certain, I don't know what they call in English. Maybe Atmajit can help. Guar ka
हाँ जी, ग्वार का
sing आता है ना, गुआर सिंग.
सिंग I never कभी सुना
Sing,
नहीं.
sing, sing. अपना dana chana, like your peanut sing. Wow.
सिंग सिंग कभी सुना नहीं. बॉम्बे में चलता होगा.
Okay. But we use that, and then you can get it. If you people are aware of it or not, if you have a Patel Brothers, the store,
Oh, yeah,
Yeah,
there's one
yeah.
near me. Yeah, not too far.
visit that on a Wednesday, because the things come on Wednesday, the fresh supplies, and you will
Yeah.
get exotic vegetables around that you've never been seen or heard of. And then you can always go on Google and see how to make it.
Dr. Thayer, before, like, about omega-3, like the algae source, what's your opinion about taking omega-3 from, not from fish, but from this plankton and all that algae?
I don't take enough omega-3 in food-wise, so I take flax seeds. And
Mhm.
that I put in my juice in the morning.
That's enough from omega-3 point of view.
Yes.
Uh,
Powdered flax seed. I put
You
chia
can,
seeds. I
you
put
can buy it, the seeds and grate your own too, grind your own, which is what I do. I put it in oatmeal.
yes.
Yeah, but is it sufficient source of omega-3s?
Of course, because you require fats, no doubt, but you don't require the fats that we talk about, the bad fats. These are the good fats. You can take them.
Okay. Okay. Thanks.
It would be nice to have a lot of Indian recipes because I love Indian food and normally it's so much fat in it.
Yeah, but we are going to do it. The next one I'm going to do, please watch on that. It's thing that my daughter and I came up with is avocado toast, but along with bean spread mixed in it. So you get your proteins too.
Bean spread, is that what you're saying?
Yeah, your bean, it's a bean sauce along with the avocado and things mixed in it, spices,
Cool.
topped with cucumbers and uh, sugar bombs. Have you heard of sugar bomb tomatoes? Small tomatoes are very nice, sweet and tangy.
Oh, do they like grape tomatoes?
The grape tomatoes are not that flavorful, but
Oh,
these very much.
okay.
So
You
you're
can.
okay with avocado? It's not too high in fat?
It is high in fats, no doubt about it. So if you got a heart disease, like I have, I would stay away from it. But if you don't have a heart disease and you're occasionally eating avocado, sure.
Okay.
So that avocado toast is my next one. Am I right, Lynn?
Yes, and
Okay.
a new smoothie recipe too.
I like
Oh,
making smoothies. I really don't like to cook, so that's my problem. I just I don't care to cook, so I don't do that much, except for steaming vegetables and stuff like that. Otherwise, I don't cook.
and try if you can. I don't do it all the time. Try and eat when the sun rays are there, and when the sun sets, stop eating.
Mm, I'm a
So
night person. It doesn't
and
work for me.
Well, you know what, Francine, I
When it
have to
works,
say
what
that
I'm doing works for me, basically. It really,
yeah. I'm not asking you to change, but
yeah.
if you're wanting to, that gives enough of a chance of almost doing the fasting.
Yeah. Yeah, I can see how
intermittent
that would.
fasting.
You can get almost 12, 13, 14 hours of fasting on that. And
I
once you
get
get
pretty
to that,
much
a little
12.
bit, you won't
Uh,
feel.
I never get over 12. I just,
So, Francine, watch some of Dr. Akil's videos, some of the things that he's going to be cooking on the menus coming up.
okay.
One of them's going to be a tofu scramble. I didn't know how to make tofu scramble. I'm like you. I wasn't trying to
Yeah.
do a lot of cooking. I had my things that I was good with, and I was good with that until I started seeing him and saying, "Oh, that's easy. Oh, now I see." And I know that Rochelle has the Food for Life classes as part of what PBNSG does, and um, those are some really good demonstrations as well, because that was my thing. If I don't see it, I don't know how to do it. Reading a recipe is one thing, but doing it is something else. Because I tried all the Hello Fresh and all of that, and it was
Did you? Okay.
tedious.
Yeah.
And so,
Try this. Invite some people
yeah,
and do a tofu scramble. Don't tell them it is tofu. And use all the spices and say this is an egg scramble, scrambled eggs.
Yeah, I would be.
I tried this on two couples on a New Year's Eve about 3 years back, and they could not make the difference. They said, great, great. Then I said, it's tofu. Then one of them had the audacity to turn around and tell me, oh, no wonder it didn't taste that good.
I know, some people they'll eat vegan food and you tell them it's vegan food and then they're like, oh,
It's all up here.
right. Mm-hmm.
Yeah.
Well, everybody, thank you so much for being here with us today. This was so much fun. And we'll look forward to seeing you next month. Now, there's a change in the date. It's not going to be at the end of the month. March 14th is our next scheduled
March
talk with
14th.
the doc.
Okay.
Or
Thanks for that
no,
update. Yeah.
yes, it is. Next scheduled talk with the doc, March 14th.
Do we
Yes,
have a
So you'll
topic?
get
Do we have a
emails.
topic? Do we have a topic yet?
Yeah.
Yes, one of Dr. Akil's favorites,
What?
sleep.
Oh,
Oh.
I didn't know, but okay.
You didn't know? Okay. Now you know.
Now I know. Now I
Yeah,
know.
okay, cool.
So
Sleep. And it's going to be a special one because he's got a guest. He's got a friend of his that's coming in to talk about the kind of
Fury.
foods. Yes, Meryl Fury is going to talk about the kind of foods that promote healthy sleep. So that'll be good.
Interesting.
Yeah.
Yeah, we'll look
Okay,
forward to
well, thank
seeing you then.
Great.
Thank you.
Great.
Thank
I
you
look
very
forward to
much.
Thank you.
Namaste. Thank
Dr.
you.
Taher and stuff. Yeah.
Bye. Take care.
Bye,
Thank you.
everybody.
Bye-bye. Thank you,
Pleasure,
Dr.
guys.
Akil.